So again, I'm Sarah Mansouri, and welcome to the BESMART webinar. Today we'll be talking about changes to our buprenorphine limits. Very exciting news following the memo that you have all received and information from our managed care organizations. So again, BESMART stands for Buprenorphine Enhanced Supportive Medication-Assisted Recovery and Treatment Program. So I'm going to walk you through the agenda. Again, just my last time saying this, this is a WebEx event. It will be recorded. The presentation will be posted after for viewing at a later time or sharing with others. Please make sure to put your chat in the chat box, and we will answer all questions at the end. All right, so just to kick it off, the agenda has 5 different parts. We're going to start with just the current state of BESMART, move towards the main event, which is the changes to the buprenorphine dosage limits, which will be led by Dr. B. Then we'll move into some key pharmacy updates from our TennCare pharmacy team and Optum. Then we'll move into our how to become a BESMART provider if you are not one already, and this will be led by Mary Shelton. And then lastly, we will do some questions and answers. Okay, so to kick it off, we will just start with the basics here of what is the BESMART program. So BESMART is, again, the Buprenorphine Enhanced Supportive Medication-Assisted Recovery and Treatment Program. This is a specialized network focusing on contracting with high-quality MAT providers to provide comprehensive care to our TennCare members with opioid use disorder. This program initially launched back in 2019, and it was initially branded as BMAT, or Buprenorphine Medication-Assisted Treatment, or the Enhanced MAT Program. We rebranded this to be BESMART in 2021, and with that rebrand came an updated program description. So the program description is the guidance around the criteria as well as what's expected of our BESMART providers. Again, this is a special network within TennCare that really focuses on providing high-quality MAT to our members. The BESMART program, again, is only for buprenorphine. There are separate program descriptions and guidance around naltrexone and methadone. And if you are wanting to become a BESMART provider, you must attest to the BESMART program description. We'll get a little bit more into that, but you also must attest to the BESMART program description even if you had it tested in the past. So let's say you've attested to the Enhanced MAT program about a year ago and have not reattested since the BESMART program description, you will not be able to keep the benefits of the BESMART program description unless you reattest. We'll say that again a couple of times throughout the presentation, but just please remember that to make sure you have attested to the updated BESMART program description. And then lastly, just as a note, it is up to the discretion of the MCOs to determine who joins the BESMART network. Okay, and just some interesting facts, we currently have 278 contracted BESMART providers across all 3 MCOs. And if you have really good eyesight, you can see the little red dots are all the providers across the state. And you can see we really are trying to make sure we have good access and that members, no matter where they're located, have access to a high quality medication-assisted treatment provider. So just from the beginning, just wanted to share with you some stats. Again, we've seen an increase in the number of providers that have participated in our BESMART network, and we also see that we have more and more members being served by these providers. So we serve on average about 5,500 unique members per month through the BESMART network. Okay. So I think it's really important to emphasize the fact that this BESMART program is built on a partnership. The only way we're successful is by having this partnership between TennCare, the MCOs, providers, and members. In the beginning, before BESMART was created or even really thought about, there was just inconsistencies with the member experience, with the provider experience around MAT. There were some cash pay issues as well as diversion of MAT. And just that general lack of coordination and alignment between all the key stakeholders. BESMART allowed us to solve for a lot of that. So we were able to find ways to provide better access to high quality MAT for our members. We're really working on stronger partnerships between all of the key stakeholders. And we have the ability to evaluate data and quality outcomes. And most importantly, through this partnership, we are able to increase the flexibilities to this group of providers. So that's where these new limits come in. as a result of this transparent relationship, we're able to continuously evolve this program. Okay. So again, what does it mean to be a contracted BESMART provider? So just want to make it super clear that even if you're a contracted TennCare provider and prescribe MAT, that does not mean you are a BESMART provider. You must contract with the MCOs for the BESMART network, and that means attesting to the program description and ensuring that you meet all the criteria within the program description. On the right-hand side of the slide, you will see a screenshot of the program description. If you want to reference it, it is on our TennCare website as well as on all the MCO pages. And again, as a reminder, even if you are currently a member, currently a provider within the BESMART network or within the MAT network, please make sure that you reattested to that BESMART program description. All right, and then just want to really bring this home with just what are the benefits for BESMART providers. Again, this BESMART program comes with a lot of benefits for the providers in addition to the members. So of course, you have clinical and care coordination support from our MCO partners. We have increased data on quality and health outcomes. All BESMART providers get quarterly quality metric reports from each of the MCOs. These are for educational purposes only, but really just to give you a sense of where your members are and just so you have the data at your fingertips. Next, you have your enhanced reimbursement from the MCO. So these are the special codes that come with the BESMART network for all BESMART services. In terms of pharmacy benefits, you have access to monopodic buprenorphine as well as a shortened prior authorization form. And our pharmacy team will talk a lot more about the prior authorization form later in the presentation. And then lastly, the main event of the webinar is that members can now access higher quantities of buprenorphine through BESMART providers. So on that note, I'm going to turn it over to Dr. B to talk about the changes to the buprenorphine dosage limit.
Good afternoon, everyone. So yes, this might be the main event, but there are also some exciting things for the PA as well. So I'm happy to get into this, the main event piece. Next slide, please. Okay, so we're just going to take a look at the history of the BESMART network real quick. So this begins in 2012, but our journey really started in 2017, where we started building out the concept of a high-quality MAT network. And in 2019, that was officially launched, which is where you probably were one part of what was called the BMAT or the Enhanced MAT Network, but it's now been rebranded to BESMART, as you now know. And of course, what we're here today is to talk about the new dosage limits. So effective today, members with OUD being treated by a BESMART provider can receive higher doses of buprenorphine. And we're only able to do this and continuously evolve the program due to the collaboration and the transparency and the partnership that we have with you. So thank you for being part of the BESMART program, and we'll get into the details. Next slide. Okay, so high-level overview. TennCare supports MAT and TennCare supports buprenorphine and wants BESMART to be successful. And we believe that the next evolution of the program is to increase the limits to 16 milligrams of buprenorphine products per day throughout all three phases as medically necessary. And within certain subpopulations or specific clinical criteria, some members may be eligible to receive a maximum of 24 milligrams of buprenorphine products for a defined length of time. And we'll get into those criteria and the length of time in later in the slides. Next slide, please. Okay, so we know, again, through that transparency and through the trust that we have with you, that you're following best practice guidelines. And so when the member is ready to talk about tapering, you're doing that. And you're also following the best practice guidelines of using the lowest effective dose to control symptoms. That said, again, our members are now going to be able to receive 16 milligrams of buprenorphine without that previous hard taper or that previous fall back to 8 milligrams. Okay. No, you're fine. All right. So this is a deep dive into the 24 milligram criteria. And again, for these specific populations below, and I'm going to go through each one of these in detail. So first is we recognize that pregnant participants may require higher doses of buprenorphine. So during the course of their pregnancy, they will be eligible for up to 24 milligrams. That is separate from their postpartum period, in which, again, they might be able to receive up to 24 milligrams during their postpartum period, again, recognizing that the need for higher dosage may be sustained post-pregnancy. Another subpopulation who is, as of today, eligible is recent IV drug user, and this is confirmed by both the prescriber attestation and a positive drug screen. So what that means is an individual who is today using and then starting on buprenorphine, so therefore confirmed by their UDS, would be eligible for up to 24 milligrams. A history of IV drug use of some point in the past, but not a current user, would not be eligible under this criteria. The next is current users who are transitioning from a high dose of methadone to what we presume would be a high dose of buprenorphine. And so that's defined as someone who's on methadone of 50 milligrams or above, and again, they're transitioning to buprenorphine for their OUD treatment. Next is current users of 16 to 24. So we recognize that there are persons who may be receiving that higher dose today. Maybe they're coming in from another state and they are, coming into TennCare would be requiring that continued dose of between 16 to 24 milligrams. So again, for 1 year, they will be eligible to receive that higher dose. We will be looking at previous claims data to indicate that they were on that higher dose during that time before they came into TennCare. And the last one is, this is a little bit different because this is trying to capture people who might not have evidence of the higher dose in claims. But for 1 year from this effective rule, for members who don't qualify in one of these other criteria, we're going to give them an opportunity to be captured within the BESMART program and the eligibility that they can also receive that greater increase between 16 and 24 milligrams, again, just for the first year from the effective date of this rule change. And just want to reemphasize that this is, we worked on this using the feedback and discussions that we had with many of our practicing physicians, and we would expect that the number of individuals who come into this bucket between 16 to 24 is a rather rare occurrence. That's what we're hearing from you, but we also understand that there is a need for it, and so we wanted to make sure that we were able to capture that within the evolution of this program. So thank you again for the feedback that you provided to be able to shape this, the new program changes. Next slide. Okay. So you saw the memo that came out. I just want to reiterate the differences between a BESMART provider and a non-BESMART provider. Again, this is because of our partnership, that we have our trust and collaboration with you. So again, if you're a non-BESMART provider, their maximum daily dose for the first 6 months is 16 milligrams. And then after that first 6 months, TennCare will only cover 8 milligrams. And again, their maximum covered dose is 16. So you can see here how that differs from our BESMART providers, where you will be able to maintain your members at 16 milligrams without the coverage can continue. And also the maximum covered dose can be up to 24 for those predefined clinical conditions. Next slide. Okay. Now we're going to hand it off to our pharmacy teams for the pharmacy and OptumRx update.
Thanks, Dr. B. Next slide. So I want to start off by saying thank you to our providers for the feedback that you've given us. We are aware of the recent issues that you have been encountering, and we thank you for letting us know what issues you're seeing on the ground. And we want to encourage you to continue to provide us with that feedback. And it can be provided to one of our 3 OptumRx provider educators. We have one in East Tennessee, Heather Klein. We have Ginger Stokes in Middle Tennessee and Judd Jones in West Tennessee. So please feel free to reach out to them whenever you have a question or concern, and they'll be happy to help. And also just want to remind everyone that we are dedicated to supporting not only our members, but our providers. So again, feel free to reach out to us with those questions or concerns. Next slide. This slide, I really want to emphasize some key pharmacy links that you may want to bookmark. The first one is the TennCare OptimalRx webpage. There's a lot of really good information, so I encourage you to go and look through it once you have time. And the last three links will take you directly to our buprenorphine PA form, our TennCare PDL page, and our TennCare criteria page. Next slide. Because of the recent changes that Dr. B went over, we have updated our PA form to reflect that. So we have removed some questions, we've added a few more in, and we've also changed the approval limits for BESMART providers. So the initial PA approval is the same for all providers. If you're asking for up to 16 milligrams of buprenorphine, the approval is for 6 months. However, for renewals for BESMART providers, we are increasing that to up to 12 months. So that renewal approval will be for 12 months when you're requesting up to 16 milligrams. However, this does not apply for patients who are on PA escalation. Next slide. So I want to go over the new PA form and just highlight some changes. There are 4 pages in the PA form. This is page 1. All providers are required to fill out page 1. So this is the top of page 1, and we just request member information and prescriber information. And I want to highlight the XDEA area because that is information that we do require, and we cannot process the PA form without it. And if you are a nurse practitioner or a physician assistant, we do need your supervising physician's name and DEA number. Next slide. Moving further down on page 1, we have 2 questions. We ask what your provider type is, and we also ask if you are contracted with at least 1 MCO as a BESMART provider and have attested to the program description. Based on your answers to these questions, it will determine what part of the PA form you will be filling out. So if you are a BESMART provider, you will be filling out pages 1 and 2. If you are not a BESMART provider, but you are a physician, you will be filling out pages 1, 3, and 4. If you are a non-BESMART provider who is a nurse practitioner or a physician assistant, you actually are not eligible to fill out this PA form because TennCare does not cover buprenorphine containing products from nurse practitioners or physician assistants who are not in the BESMART network. Next slide. So this is the bottom of page 1. There are 2 tables. The one to the left is for BESMART providers only, and the table to the right should be filled out by non-BESMART providers who are physicians. I want to draw your eye to the highlighted areas on the left. Buprenorphine naloxone film is listed as a preferred medication for BESMART providers only. This is not an option for non-BESMART providers. And secondly, for the buprenorphine mono product, breastfeeding is now considered a pathway for approval for that mono buprenorphine product. That is a recent change as well. Next slide. So now we're moving to page 2. So only BESMART network providers should fill out this particular page. At the very top, we reemphasize what the quantity limits are. So if you are prescribing Suboxone, Subutex, or a generic equivalent, TennCare covers up to 16 milligrams per day. If the product selected is Bunevel, we cover up to 8.4 milligrams of buprenorphine per day. And we are aware that Bunevel is no longer being manufactured, But there are some pharmacies that do have Univel on their shelves, and we are still getting claims for Univel. So once that is no longer the case, we will come back and update the form and remove Univel. The question under that statement also asks if the provider is requesting a larger dose or quantity than TennCare covers. If your answer is yes, you will also be required to fill out question 5 on this page, and I will go over that in a little more detail on the next slide. But the 4 questions that are listed on this slide should look very familiar. Those are they were on the last PA form. The only difference now is that we removed 2 questions. So the question that talks about concomitant use of buprenorphine with opioids or with benzodiazepines, that question has been removed for BESMART network providers. And we also removed the question about transfer of care. So that question has been removed and it has been replaced with just a statement reminding providers to reach out to the provider who last put in a PA for that patient for buprenorphine, just to ensure that they know transfer of care has occurred. But I will show that to you on the next slide. And we can move forward to the next slide. So this is question 5. This only needs to be filled out if you are requesting a quantity, if you're requesting more than 16 milligrams per day. So there are certain circumstances that TennCare will cover up to 24 milligrams a day, up to 1 year. And those different scenarios are listed out. So please read each one of them to determine which clinical rationale applies to your patient and select the one that does, and please provide us with the necessary supplemental information if it is indicated. And under that question 5, there is that statement that I talked about in the previous slide that says if the most recent prior authorization approval for buprenorphine, naloxone, or buprenorphine was requested by a different prescriber, please ensure transfer of care has occurred. Next slide. So the most important part is your signature. We cannot process the PA form without your signature, so please be sure to include that. And if you have any questions or concerns about the new PA form, please feel free to reach out to one of our 3 provider educators that are listed on the slide. Next slide. Okay, so if you are a non-BESMART provider, you are required to fill out pages 3 and 4 in addition to page 1. And this will include about 15 questions that you will need to answer. And as a reminder, the new buprenorphine limits that we have discussed in the previous slides will not apply to non-BESMART providers. Next slide. These are the other questions that are also required for non-BESMART providers to answer. And also we need your signature as well at the bottom in order to process this PA form. Next slide. For both provider types, there are 2 ways to submit your PA to us. You can submit it electronically via CoverMyMeds, or you can fax the paper form to the number listed on the slide. You will get an answer within 24 hours via fax as long as you did complete the form in its entirety and you provided us with any supplemental information that we requested. If you would like, you can also call our call center at the number listed on the slide to get your outcome. Next slide. And I will turn it over to talk about steps to become a BESMART provider.
Thanks so much, Dr. Underwood. That was a lot of great information. And I believe Sarah may have mentioned this, but I'm not for sure. But we will be posting these slides on our webpage along with the recording. So lots of information there. I'll go over some additional information with contact numbers, just like Dr. Underwood did. But we'll have all this posted on our website. So, hey everyone, good afternoon. I'm Mary Shelton. I'm the Director of Behavioral Health Operations at TennCare, and it's very nice to be with y'all today. I'm going to review the steps to become a BESMART provider, even if you're a current TennCare contracted buprenorphine provider or a prospective provider. So next slide, please. So if you're currently contracted with at least 1 MCO for buprenorphine MAT, you should have already received the BESMART program description for attestation. So all providers must complete the BESMART attestation for each MCO that they're contracted with, and that is to remain in the BESMART program and receive the benefits previously mentioned. So as a reminder, the BESMART program description is the next iteration of the buprenorphine medication-assisted treatment provider network program description. So even if you've already attested to the BMAT program description in the past, you are required to reattest to this BESMART program description. And if you have any questions or concerns about this, or if you haven't received the attestation, or if you misplaced the information, then I'll share contacts, names and numbers and emails for the MCOs and TennCare in just a few minutes. Next slide, please. So this information is for nurse practitioners and physician assistants. There have been some questions about the requirements and criteria here, so I'm going to take a minute to review this information. This past year, legislation was passed which allows for NPs and PAs to prescribe buprenorphine, and here are the conditions for doing so within the TennCare network. So to be eligible to contract with TennCare as a BESMART provider, a nurse practitioner or physician assistant must meet this criteria. So be contracted within the BESMART program, have a supervising physician that is also contracted within the BESMART program, specialize in family, adult, or psychiatric medicine, be a part of an OBOT, an office-based opioid treatment facility, a CMHC, a community mental health center, or an FQHC, a federally qualified health center, hold an XDEA number and a TennCare Medicaid ID, and then follow the member limits according to legislation. And so you see here a web address, and in a few minutes I'll tell you how to get to the opioid strategy webpage, but this is where the information is located. So that's for nurse practitioners and physician assistants. Next slide, please. So for prospective BESMART providers, if you are not already contracted with a managed care organization and are interested in becoming considered as a contracted BESMART provider, here are the basic requirements that a provider needs to complete before an MCO can engage in possible contract negotiations. So have your Medicaid ID, and you may apply online at the TennCare webpage for this. So go to the TennCare main page, click on providers, and at the very top of the left-hand side, you'll see provider registration, and you'll follow the information and directions there. Be a licensed physician, nurse practitioner, or a physician's assistant that meets the defined criteria, the information I went over on the preceding slide. Then review and be able to, or be on track to provide all of the services outlined in the program description requirements, and attest to the MAT program description for each MCO you contract with. So a couple of additional points here. I want to point out the difference between being in network with a managed care organization for other services and being in network for BESMART. So it's quite possible that you're already in network with one or more of the MCOs for OBGYN services or internal medicine services, but the BESMART network is a separate provider network. So in order to receive the benefits previously mentioned, the provider must be contracted for the BESMART network with the MCO. And another clarification I wanted to share is that each MCO's network is solely for that MCO. If you are contracted with Amerigroup, that doesn't place you in Blue Care or United's provider network. A provider must have a contract with each MCO to be in that MCO's network. All right, next slide, please. So here's just a brief review of the steps for contracting within the BESMART provider network. Again, if you have any questions, we really encourage you to reach out to the managed care organizations, and I'll share that contact information with you in just a few minutes. All right, next slide, please. Okay, the provider interest form. For those of providers who are not already contracted with a managed care organization for the BESMART network, but you are interested in receiving more information and possibly participating in the BESMART program, we have a provider interest form located on the TennCare opioid strategy webpage. So we encourage you to complete this form, and then we'll send your contact information to each of the MCOs for their review. So the direct link is here, but you can also go to the TennCare homepage. Then you click the tile that's right there on the homepage called TennCare's Opioid Strategy. Scroll down on the next page to where it says Medication Assisted Treatment Information. And there you'll see the buprenorphine MAT program descriptions. And then the last link there in that one section says BESMART Provider Interest Form. So please complete that form. If you're interested, we'd love to hear from you. But just a reminder that completion of the provider interest form does not guarantee contracting with the managed care organizations. All right, next slide, please. So as promised, here's the contact information for TennCare and our contracted managed care organizations, Blue Care, Amerigroup, and United Healthcare. And like I said, we'll post this video and slides from today's webinar, but just a little helpful hint if you want to take a picture of this slide, that way you'll have everybody's contact information right now. And if you have any questions, you can contact them. Also encourage you to complete the provider interest form. So that's all I have, and I'll turn it over now to TennCare's Chief Medical Officer, Dr. Victor Wu.
Dr. Wu, you're on mute.
Sorry about that, everyone. Thanks for that fair reminder. And I just first wanted to start off by saying thank you to everyone for being willing to spend time with us. We actually have 105 providers and provider representatives on the call with us today. And that's just a testament to the commitment that you all have shown for many years in treating our TennCare members and helping them in their recovery journey. I know many of you either skipping lunch or taking time away from your patients in order to join, and I hope this information has been helpful for you. But again, let me just reiterate that your partnership and your support and your feedback, honestly, has really helped us to evolve and continue to find ways to navigate providing the highest quality, most effective recovery care to members as possible, while still maintaining and living within the rules of our agency as well. So let me just reiterate some of the key points. Again, BESMART, that phrase, I hope everyone just kind of can use that now from going forward. It's our newest acronym, but it's one's going to stick for a while. We promise it'll stick longer than 2 years than the last time. But for all BESMART providers, if a member comes to see you as part of their care, the member will receive coverage now for 16 milligrams of buprenorphine products throughout their induction, stabilization, and maintenance phases as you deem medically necessary. We very much believe in the relationship between patient and physician, or patient and provider, and we know that you're the best ones that are in the place to make the decision of what to recommend for their treatment. So I hope that is a very positive change for you, and a change that helps allow you to provide the care as needed to our members going forward, but they have to come to see providers that are in the BESMART network. Second, as Dr. B very clearly outlined, we are now open and allowing and coverage for buprenorphine doses up to 24 milligrams for the length of time established. There's a couple of questions that have rolled in about that, and we'll speak to that in just 1 second in the Q&A. But that is a new benefit that's allowed for providers that are in the BESMART provider network, providing this care to our members. Second, you will need a familiar size with a new PA form. It's very similar to the one before, but there have been some small changes and streamlining a lot of the changes to make that even easier and hopefully more efficient for you as providers in the BESMART network. If you're not in the BESMART provider network, you will continue to fill out the longer form as part of our prior authorization process for buprenorphine. And thirdly, just to reiterate, if you are in the BESMART program, or if you're in the enhanced MAT or the MAT or BMAT network before, but you have not yet attested the BESMART program description, you need to attest to that with your MCO and follow the processes in order to access these new benefit options for your members that you treat, for our members that you treat. So that if you haven't yet attested to it and have been in contact with your MCO, you need to do that ASAP. We'll make sure to provide contact information on how to do that, but that has to be done before you can be part of the new processes we discussed today in the webinar. If you're not yet in the BESMART program and you're interested, please reach out to TennCare either through the provider interest form or directly to our MCOs. We continue to need as many people that are providing high quality addiction and recovery care in the state to be part of our partnership here with our TennCare members. And we're really grateful for the number of providers that have already joined in. And if you're still thinking about how to become a partner with TennCare, please reach out to MCOs and help them understand the capabilities and the services you're providing, and really review that BESMART program description. Lastly, and I know we've said this throughout, but it is really true that our evolution and our progression in providing high quality care for our members and making sure they have access to high quality care really depends on this partnership and a trusted relationship with you all as our BESMART partners in this. And so the more that we can hear feedback from you, the more that you participate with us in our webinars, in our on-site quality reviews, in discussion, it will help us all become better partners and really ultimately impacting the health outcomes and helping our members maintain recovery for as long as they can during their journey with addiction. And so I'm really excited that this is a new kind of phase that we're moving into. And again, it's just a testament to the efforts and the partnership and the support that you all have had shown us, and that we're hoping to show you as well. And we look forward to hearing feedback from you throughout this. And so all of the members on the team today at TennCare, we would love to hear from you throughout this process as we as we roll out the new changes. On the pharmacy side, again, we know it's a very complicated challenge to implement some of these changes when we have different networks of providers. And so your feedback is really important to us. We're committed to making sure all members can access the medications that they need, but it really relies on you all providing specific examples, patient information, prescriptions, specific pharmacy locations if there are challenges. That really helps us troubleshoot and maintain and drive toward the same goal as you all. So with that, let me just end to say thank you so much. We really crave and value partnership and communication with you all. We're going to answer some questions now, so make sure to enter those into the chat function as we move forward. We'll try to answer as many as we can, and some of these questions that we aren't able to get to today, we'll go ahead and post online as well and as part of the webinar. So with that, I want to turn it back over to Sarah to help kind of moderate some of the questions and answers that are coming through the chat.
Great. Thank you, Dr. Wu. Again, if you have any questions, we've seen some great questions come on through the chat. Just please make sure you don't use the Q&A function. I want to make sure that we see everyone's question. So the first question I'm going to direct to Dr. B. Can you please describe what evidence-based guidelines the BESMART program is based on?
Sure, thanks for that question. So the BESMART program description is predominantly based on ASAM and SAMHSA-based documentation or best practice guidelines. And there's also a couple perhaps references to our partner agency, the Tennessee Mental Health and Substance Abuse Services, their OBOD outpatient buprenorphine guidelines. So those are the predominant sources.
Great. Thank you so much, Dr. B. The next question is for Dr. Underwood. Will there be a change in the prior authorization forms to get 16 milligrams covered as opposed to 8 milligrams?
Yes, so the new PA form will be updated later, will be posted to the website later today, but on page 1, there is a section that had the 2 tables where you will write out the quantity that you are requesting. And as long as it's within the 16 milligrams, and you're a BESMART provider, that will be approved as long as you also fill out questions 1 through 4. So there will be an updated PA form that comes out later today that will be posted to the website. But you would just fill out that table to the left on page 1 to notate what you're requesting.
Great, thank you. All right, just moving right along. Next question is for Dr. Wu. Will TennCare cover SUBLOCADE?
Thanks for this question. So SUBLOCADE is absolutely covered. It's covered, though, through our managed care organizations as a medical benefit because of the way that it's inserted. So I'm actually going to ask each of the medical plans just to give a short update about the processes with which to get SUBLOCADE covered for under their pharmacy benefit. So let me start with Dr. Allender and United.
Hi, yes, this is Jacqueline Allender from United Healthcare. SUBLOCADE is covered under the medical benefit, and you can visit our uhcprovider.com website to find the prior authorization portal. It does require prior authorization just to ensure, clinical safety, but that's how you can access that product.
Thanks for that. And let's go to AmeriGroup next.
Hi, Dr. Wu. It's Renee Bentley from AmeriGroup, and I am going to attempt to answer this question. I think we have a very similar process to what has been shared for United, but to the best of my knowledge, that is a covered benefit. The process is outlined on our provider website. Any specifics around that, I will be happy to engage our pharmacist here at AmeriGroup for specific questions.
Great, thanks, Renee. And how, let's go to Blue Care next.
Hi, it's Melissa Isbell at Blue Care. We actually have some guidance in our provider administration manual that describes how to get reimbursed for drugs that are administered in office, and Sublocade falls into that same category of drugs that are administered in office.
Thanks. And so I'll just reiterate that all three of the plans, we provided contact information in the notice that went out. You can contact them at any point. They'll definitely be able to direct you either to the direct question if you have need to have more information, or they can refer you to their pharmacist on their team as well to help with getting those criteria for the Sublocade. So, but it's definitely a covered benefit, but make sure to reach out to your MCO health partners on that, as opposed to reaching out to the pharmacy team.
Thank you, everyone, for that great answer. Next question is going to Dr. B and Dr. Underwood. So we have a question that if we have two providers that work in the same clinic, is it possible for both providers to be approved to prescribe buprenorphine for one patient?
I can actually take that one. If both providers are in the BESMART network, the PA, both providers can prescribe off that approval. The only issue is if one were in the BESMART network and one were not in the BESMART network. But as long as both are in the BESMART network, both providers can prescribe off that approval. And that is done automatically. There is no additional steps needed.
Great. All right, moving on to the next question. This is also for Dr. B. Since MAT providers can fall in and out of care due to various circumstances such as relapse, does a 12-month max duration for 24 milligrams represent a lifetime limit for a TennCare member?
Hi, thank you for that question. So I should have answered this during my slide because I should have seen this one coming. It is not a lifetime benefit. So we consider those clinical scenarios an episode. For example, someone could be pregnant more than once. Someone could be an IV drug user at different times in their life. So it is not a lifetime benefit, but an episode in which you qualify for one of those criteria. So at the time that you're stating the individual is an IV drug user, it's not a history of IV drug use, but active use. And say 2 years later, they're using again, they would qualify again for that benefit.
Great. We have so many great questions coming into the chat. Again, make sure if you still have any questions to keep putting them in. We're going to keep rolling. But the next one is for Dr. Williams-Clark. This question says, sometimes I have to enter duplicate information to cover my meds during the PA process. Do you have any recommendations, or what should this person do?
Hi, yes. Hi, Sarah. I'm Renee Williams-Clark, pharmacy officer here. And so this was recognized as an issue in which Cover My Meds was asking duplicate questions in order to try to advise on the clinical portion of the review process. But I can affirm that as of today, with the rollout of these new criteria, guidelines, and guidance, that has been resolved. I still want to ask our providers, as we mentioned earlier and Laura alluded to, you guys are very critical to our process and us understanding any operational barriers or challenges. And so we would ask that if you are experiencing issues with the Cover My Med process, that you reach out to our OptumRx provider educators in East, Middle, and West Tennessee. Their information is included in our slides, but they include Heather Klein, Ginger Stoves, and Judd Jones. Thanks, Sarah.
I'll quickly bring those up. Where does it keep you on here? And if you want to take a screenshot, again, these will be posted online. but screenshots are always a good way to capture the information quickly.
I appreciate that, Sarah. It's again, critical for that feedback and input for us to continue to evolve the program. So we appreciate that. And as you can see, we try to work as quickly as we can to get issues resolved as we find them. So, and I guess we can go back to any other questions. I'll turn it back over to Sarah.
Perfect. All right, I'm going to stop sharing my screen, so get your last screenshots in. And again, they will be posted. Okay, so the next question is actually for me. So I'm going to run through this. So the question is, for a nurse practitioner working in an OBOT, do they need to have direct supervision with the MD in the office with them at the same time, or can the supervising doctor not be on site with the NP? So this goes back to the actual legislation. The legislation for OBOT says that it has to be direct supervision from the physician over the NP or PA. From talking to the legal teams, direct supervision does mean on site at the same time. So that's to be physically in the same location at the same time. However, the legislation is different for CMHCs and FQHCs and does not say direct supervision in that case. So in FQHCs or CMHCs, the supervising physician does not need to be on site, but for OBOTs, they do. And you can find all that information clearly listed, again, on our opioid strategy page that we'll make sure to send out before logging off so you all can have the direct link. But it's also multiple places in our presentation, and you can also just Google opioid strategy, TennCare opioid strategy page. Okay, so the next question is going to be for our MCO partners. Can you talk to us about how you confirm if the provider has completed the attestation? And we'll start with AmeriGroup.
Hey, it's Philip Morrison with AmeriGroup. As far as you can contact your provider relations representative and they can let you know, we do keep a running spreadsheet of all of our BESMART providers, and we do keep copies of all of the attestations as well. So we'll be glad to confirm that for you.
Right, moving down the alphabet to blue.
Hi, it's Melissa Isbell again. We also maintain a smart sheet of our BESMART prescribers, and we maintain our documentation there related to attestation. So if you have questions about specific prescribers who are in our network, you can outreach us as well.
Great, and last up, United.
Yes, very similar process. Feel free to reach out to the email address inserted in this presentation or your provider rep. I'm more than happy to help confirm.
Awesome. Thank you all. Okay, this next question is going to be directed towards our pharmacy team. So for our patients that are already on buprenorphine and had a recent prior authorization approved for only 1 per day, do we need to resubmit those prior authorizations for the 2 per day?
That's a good question. As of right now, yes, you will need to resubmit for 16 milligrams. As of right now, we only have your patient approved for 8 milligrams. So if you want your patient to get the 16 milligrams, we would need a new PA form.
Right. Thank you for that great question. Okay, we're just going to keep on going. So the next question is also going to be directed at our MCOs. So the question is, how can we partner for naltrexone medication-assisted treatment? So let's start the opposite way. We'll start with United. Again, this question is about how can we partner for naltrexone?
Yes, so please feel free to utilize that email address in the webinar PowerPoint slide deck. You'll probably be routed to me, so I'm more than happy to facilitate those conversations and discussions around partnering.
Perfect. All right, Blue, always in the middle.
So for naltrexone, we don't have any additional network requirements layered on. If you participate in our Blue Care networks, and you are a prescriber, you're eligible to prescribe naltrexone. I'm not sure if that answers the question, but naltrexone is something that can be prescribed by basically any prescriber in our networks.
Melissa, just to add on to that, and Jacqueline, I don't know if you want to jump in on this too, is there any specific person or provider rep at your plan that a provider could reach out to discuss if they have other questions?
For United, it would be me. Oh, sorry. And I'll just drop my email in the chat box to everybody. You know, just if you want to have clinical conversation or broader conversation, more than happy.
And for Blue Care, if you'll utilize the MAT referral email box that's in the presentation, then we can route those questions appropriately.
Great. All right, last up, AmeriGroup.
Yeah, it's Philip Morrison again. You can email me directly, and I'll be glad to assist and get it to the right place.
Right. And again, the contact information is on the slides. And that leads me to the next question of where can I find a copy of these slides? Again, these will be posted on our TennCare opioid strategy page, both the slide deck as well as the recording of this webinar. We will have a link posted probably in the next 3 to 4 days, you can expect it. And the MCOs as well will have this information to share. So look on the TennCare opioid strategy page. We'll make sure to plop the link in at the end of the question and answer session. And then the next question is, are there notices being sent out to TennCare providers to advise of the new program? So we did send out memos at the end of March discussing the changes to the buprenorphine limits. All 3 MCOs sent out a memo. It was aligned across all 3 plans, all said the same thing, but it was the memo documenting these changes. The PBM, or Pharmacy Benefits Manager, also sent out a provider notice that you can locate on the OptumRx TennCare website. Again, these slides and webinar will be posted, but please make sure to reference both the memo, the slides, and the PBM notice. All right, I'm going to give it a couple more seconds to see if we have any other questions come in. But let me see. All right, I just want to reiterate the question about will pre-existing PAs need to be resubmitted in order for 16 milligrams to be approved. So Laura, I'm going to send that one back to you again. Just want to make sure, since it's so important. Again, the question is, will pre-existing prior authorizations need to be resubmitted in order for the 16 milligrams to be approved?
Yes, that will need to be resubmitted to us, because if your patient was previously only approved for 8 milligrams, that is all that will go through at point of sale. So we will need a new PA requested that actually requests the 16 milligrams.
All right. And Laura, you're on a hot seat still, so don't mute yourself. Where can I find the PA form?
Okay, there's a link, I think it was in the slide, to the actual buprenorphine PA form. I will say that it is not live at this second. It should be posted within the next couple of hours. But that is the link. The link will not change once they post the updated version. Yes, so that second link that's on there, that is the link that you want to use to go directly to that buprenorphine PA form.
Take your screenshots. Again, these will be hyperlinks, so you should be able to just click them once we post the slides. And you can also always Google OptumRx TennCare. It should bring you up to the website. Okay, Laura, I think we have another question for you. Can you also clarify the length of time of the approval?
Okay. So if you are requesting up to 16 milligrams of buprenorphine, your initial PA will be approved for up to 6 months. That was no change. However, part of the new changes included that if you are a BESMART provider, your renewal, so your patient has already had the first 6 months and now you're submitting another PA to continue their coverage, their renewal approval can now be up to 1 year. So that is a change, but this will not include any patient that is on PA escalation. And this is only for patients that are for providers who are requesting up to 16 milligrams. 24 milligrams has its own approval limits.
All right, great. Well, we're staying on the pharmacy route and pharmacy team. This one's for Dr. Williams-Clark. What is the documentation required for a naloxone allergy?
Absolutely. So to properly document or to prove appropriate documentation for naloxone allergy, we would need a chart or some other derived care note indicating intervention was required to reverse an adverse event with the use of naloxone. I think you are on mute, Sarah.
I am. Such a 2021 thing, talking on mute. Okay, so the next question is, how do I find a BESMART provider? So I'm going to have each of our plans answer this question. So we'll start with AmeriGroup on this one. So again, the question is, how do I locate or find a BESMART provider?
Yeah, if you go to our website, to the provider portal, we do have a specific link just to BESMART providers. So again, you can contact any one of your provider relation reps, and they'll be glad to walk you through the website if you have any issues trying to locate that link.
Great. Yep. And I will say they're very easy to find. I reference them all the time, just like any other provider directory. But up next, we'll go to Blue.
For Blue Cross, you can go to our online provider directory as well, and there is a search mechanism to find MAT providers. More recently, we've also implemented a mechanism to try to track real-time slot capacity within our prescriber network, and a lot of our providers are actually providing us that information voluntarily. So if you have any issues finding an in-network prescriber who actually has the ability to take a new referral, you can outreach us and we can assist you with that.
Great. And lastly, United.
So same process here. You can utilize our provider directory online. Our provider reps can help. The email box that I've referenced in this slide deck is also a point of contact. All of our care management teams have a list of our BESMART providers. So really any point of entry back to UHC, you can inquire and we'll help support with that information.
Okay. The next question is for Mary Shelton. So a couple of questions have come in talking about OBOT licensure and certification and classification. Can you tell the providers who they should reach out to get any clarification on OBOT licensure?
Absolutely. So the best place to reach out for OBOT licensure is our sister state agency, the Department of Mental Health and Substance Abuse Services. So you can go to their webpage. You can Google TDMH SAS, or their webpage is tn.gov/behavioral-health, and navigate to their licensing page. And on their licensing page, they have the 3 grand regions, East Tennessee, Middle Tennessee, and West Tennessee, with phone numbers. And you may contact the Department of Mental Health and Substance Abuse Services licensing offices and inquire about becoming a licensed OBOT. So TDMH SAS, they're the ones that license the OBOTs, and I recommend that you contact them. Thanks.
Great. I love that. Questions are still rolling in. Okay, so this one's also for the MCOs again. So who do I contact at the MCOs if I have a follow-up about BESMART? Just general follow-up questions about the BESMART program. So we will start with United this time.
Yes, so I shared my name and email address in the chat box. You can reach out to me, and then I'll also drop in the other email box in the chat that I've been referencing where you can contact us as well.
And I'm going to keep scrolling till I can find that contact page. Here we go. Here are some of the general numbers as well. So we'll just let Blue, if you want to describe where providers can reach you all if they have any other questions.
Sure. So if there are questions about the BESMART program and you send your question to the MAT referral email box that you see there on the screen, then we can route it appropriately. If it's a network question or if it's a clinical question or a quality question, we can route it from that email box.
Great. And then AmeriGroup.
Yes, so on the screen you have the provider relations internal team contact information. That will get you more than likely to Philip Morrison, who you've heard from today. So if there's any contracting, credentialing type of questions, that would go there. But absolutely, if you just want to talk about being a part of the BESMART network, the program description, things like that, please outreach to me. I will make sure that you guys have my contact information. Philip and I work closely together, so you'll could probably talk to us both at the same time. But just from a programmatic perspective, I would be that outreach here. Thanks.
Thank you, Renee. All right, I'm going to stop sharing my screen, so take your last screenshots, and again, these will be posted. Okay, this next question is for Dr. Williams-Clark. The criteria indicates a limit of 16 milligrams per day, but specifically states that as a single daily dose. What if our physician feels the patient should split the 16 milligrams into twice daily dosing?
Yes, we actually do approve and allow for twice daily dosing or twice a day dosing for buprenorphine.
All right, simple answer. I didn't even have time to take a full sip of coffee. Okay, I am going to give it maybe just yes.
I just want to clarify on that end for Dr. Williams-Clark. So the PA would have to be submitted with that request, correct?
Yeah, so there is a space that was previously designated to check if twice a day dosing is desired, and it is allowed.
That was another recent change.
All right. Great. And then we have a question that just came in. I'll take a stab at it first. And then pharmacy team, please jump in. But the question is, where is the PA form for non-BESMART providers located? So it is all in one PA form. If you go to that link that we showed you earlier, you just scroll to page 3 and 4 of the PA form, and you will find the non-BESMART provider section. Page 1 does have a table on it that Dr. Underwood kind of walked you through. It has a left side and a right side on it. And I believe the right side of the chart is for non-BESMART providers, and that will cue you to go to page 3 and 4. But Dr. Underwood, I don't know if you want to add anything to that. And then maybe you can also just reiterate again the importance to re-update your PA form.
Sure, yes, you're correct about the non-BESMART provider form. You will fill out pages 1, 3, and 4. And on page 1, you will fill out all of the top of the form, and then of the 2 tables, you would fill out the right form. Regarding the updating your PA form, if your patient is currently on 8 milligrams and you want them on 16 milligrams, you will need to submit a new PA form.
Great. Okay, well, thank you all so much. We're going to close out here. We got really great questions and just really appreciate your engagement. We're excited about the evolution of the BESMART program, and it's really thanks to your partnership as a provider community, partnering with TennCare, the MCOs, PBM, all the key stakeholders. So thank you. And again, for questions after this, I'm sure you'll think of questions later on. We have our OptumRx pharmacy provider representatives by region. They are listed on the slides. Please use their contacts. They are very great resources. Next, you have up our MCOs. So please make sure to copy their contact information that they shared through the chat. Again, it will also be on our slides posted to the website. And you have our direct TennCare contact information as well. And we can always help route some of your questions if you're not sure who to direct them to. So if you are on the call with us today and you are not a BESMART provider but are so inspired and want to become one, please make sure to check out our opioid strategy webpage and fill out that BESMART provider interest form. We will be routing that provider interest form to our MCOs on about a weekly basis, and they'll use that to contact you to see if you're a right fit for the network. So again, if you have any questions, please feel free to email us and we'll make sure to follow you up. We really welcome your feedback on everything we presented today and want to continue that partnership. So thank you all again, and really looking forward to hearing from you. All
right. Thanks, everybody.
Thanks.
Thanks, everyone.